Assalamualaikum warahmatullahi wabarakatuh and a very Fatihah. Welcome to our CME number 11 today. Before we start our CME today, I would like to remind the participant to turn off your microphone during the talk and don't forget to register in iAttend for attendance. For medical practitioners, kindly fill in the Google form for CPD point. The Google form link will be given in the chat box later. Please be informed that this CME is live streamed via SASMEC YouTube channel. If you have any questions, you can type in the chat box or you can interact with our speakers today during Q&A session. Without further ado, I would like to invite our speakers today. We do have two speakers for today's CME, Brother Ahmad Shauki bin Adnin Hasnam and Brother Chizan Wei from Department of Pharmacy, Sultan Ahmad Shah Medical Center, SASMEC at RIUM, to give their talk with the title, Dilution, What Do You Need to Know? Please welcome.
Okay, thank you, Sister Fasiha. Hi, everyone, and a very good morning. Assalamualaikum warahmatullahi wabarakatuh. So, my name is Ahmad Shauki Adnin, one of the pharmacists from the production pharmacy unit. So for today's CME from the Department of Pharmacy, there will be two parts of presentation regarding the dilutions of medication. For the first part, I'll be covering for the parenteral nutrition, particularly for the adult bag. And the second part will be covered by Brother Chizan Wei regarding the injectable medications in the inpatient pharmacy. So a brief introduction regarding our unit, production pharmacy unit. So our unit caters sterile preparation products such as parenteral nutrition, especially for adults and neonates, cytotoxic or chemotherapy drug, reconstitution, and also other sterile preparations such as eye drops and intravitreal preparations, to name a few. So all these preparations were done under aseptic technique in our clean room facilities. So this is the today's agenda under my part. So I'll be explaining a bit regarding the parenteral nutrition dilutions, especially for the adult bag. So a bit introduction regarding the parenteral nutrition. So parenteral nutrition is one of the nutrition that being given through parenterally, either through central line or peripheral line, apart from enteral nutrition and oral nutrition. So it is usually indicated when the patient is having trouble with their oral intake or having trouble to gain calorie or energy from through the enteral route. So this is when the parenteral nutrition comes in hand. So for adults, most of the hospital immediately starts using all-in-one bag or 3-in-1 commercial PM bags. It is a ready-made bag from the supplier. So the one bag is being divided into several partitions, mostly divided into 3 partitions that consists of macronutrients. One of the partition consists of macronutrients such as carbohydrate, as you can see on the picture, lipid, the white milky color fluid, and also the protein. And all of the bags usually comes with electrolytes. And there's also micronutrients such as vitamins and trace elements, but usually it is not being readily injected into the bag. So we need to administer it separately. So these are the list of the available bags at our hospital. We have Smurf KB1 Central 1100 kilocal in 1000 ml. Smurf KB1 Central 1600 kilocal in 1.5 liter. Smurf KB1 Peripheral 800 kilocal in 1.2 liter. Smurf KB1 EF EF stands for electrolyte free, which means there's no electrolyte at all in the bag. So small Kevin EF central 550 kilocal in 500 ml. And the last one is NutriFlex Omega Special 740 kilocal in 6 to 5 ml. So all of these bags have different kilocal, different energy supplied by the bags. And all of these bags are strictly need to be given through central line only due to the high osmolarity, except for the small Kevin peripheral 800 kilocal, the third one, that can be given through peripheral or central line due to its low osmolarity. So I will show some videos on how to mix them, as all of the bags come with 3 partitions. Thus, they need to be mixed, and the partition need to be break first to be mixed prior to be given to the patient. So here. So the video just now is it's a mixing process for the brand of Smurf Kevin Central, Smurf Kevin, sorry. So I will show the second video regarding the dilution process of the other brands that we have, which is NutriFlex. So for the NutriFlex, you can focus on the middle video, as this video shows the comparison between the brands that are available in the market. So mixing the NutriFlex, you can focus on the second person, the middle person. That's all the video for the Nutriflex. If you notice that there's a difference between mixing the Nutriflex bag and also mixing the smooth Caviwan bag. But the aim is still the same, which we want to mix all those 3 macronutrients together prior giving it to the patient. So all bags come with its own expiry date, but after the mixing or the dilution process, the stability or the expiry date has been reduced. So all those mixed bags will be stable for 6 days under 2 to 8 degrees Celsius, the fridge temperature, plus 1 day of under room temperature for 24 hours. The storage also has been tempered. So for the unopened or unmixed bag, it can be stored under room temperature. While for the mixed bag, we need to store in the fridge 2 to 8 degrees Celsius, and it needs to be protected from the light. Hence the supply of the cover bag, as you can see on the right down side here, the cover bag for every parenteral nutrition bags that used to cover the bag during the administration process. So for every parenteral nutrition bags that being supplied from our unit, it will come with its own specific labels. So this label is it's very important as it consists of name for the patient, their registration number, the type of the bag that we are using. As you can see in the label is stating a small Caviwan peripheral 800 kilocal here. The kind of additive that we insert into the bag, and also the micro and macronutrients from the bags. But the most important thing is the details regarding the infusion rate here, and also the duration of infusion, as both of these will determine on how many kilocal or how many energy that the patient will be receiving from each bag. So for the duration of infusions, there are 2 types of duration that we can give the parenteral nutrition to the patient. The first one is continuously for 24 hours, which means the patient will be receiving the parenteral nutrition without any rest. The second one is we call as cyclical infusion, which means we give it cyclically for a certain period of times, and then the patient will have a free PN free period for several hours. So let's say the cyclical, usually in our hospital, we give around 16 hours of infusions in 1 day. So there's a remaining of 8 hours for patient to have a free period time from the PN. So during this free period, patient can do other things such as going for rehab or walking around or ambulate around the ward, just to prevent from staying on the bed all the time. So there's also additional labels that are being provided from our unit, as you can see on the right down side in the red box. So these labels is for special case for patient. So the special case is, let's say the highest bag that we have currently in our hospital is 1600 kilocal per bag. So that's that's the highest one that we have. But there are certain patients that requires more than 1600 kilocal in 1 day. Let's say, as example, they need around 2000 kilocal. So 1 bag is not enough for the patient. So in this case, we need to give at least 2 bags for the patient in a day. And this situation can cause a little bit of confusion towards the nurse, as they're not sure which bag need to be hanged first, and which bag is the second bag that need to be hanged. So this label, we hope that this label can help the nurse on this side, on assisting them on knowing the bag that should be hanged first, as there's timing and the that we put, and then also the second bag also will come with the label as well. So that's all from my part regarding the parent nutrition. So I will pass to Brother Chi. So any question regarding the dilution of the parent nutrition, I will answer after the Brother Chi's presentation.
All right. So thank you, Brother Shauki, for the details presentation on parental nutrition. I'm gonna talk a little. Hi, my name is Chi. I'm gonna talk about a little bit about dilutions other than parental nutrition, especially focusing on injectable items. So what do you need to know? Let's have a little bit of intro. So why is it important? Of course, we are focusing on medication safety. So according to MERS, which is Medication Error Reporting System in Malaysia, injectable items usually have a few medication error related to dilution, route of administration, infusion rate, and dilute. So actually this can be prevented as we already have established protocols and guidelines. So let's see on this star here, medication error can compromise patients' confidence in healthcare system by exposing them to the risk of adverse reaction and increased healthcare costs. So we want to avoid this. This is a preventable medication error. So what can we do? So the Department of Pharmacy will be taking initiative to promote medication safety culture. How? It's to ensure long-term and continuous quality improvement in healthcare. By improving and strengthening medication safety practice. So the Department of Pharmacy in SASMED has already taken initiative, and we are in progress of preparing a dilution guideline for injectable drug available in SASMED. However, it's still in progress. And in the meanwhile, for waiting this guideline to be published, there are a few other guidelines to be used. This guideline have the same aim, which is to reduce the risk related to injectable drugs. So let's see what kind of guidelines does. It's available widely online that is applicable in Malaysia. First, of course, there's KKM dilution guideline for injectable drugs. Then there's dilution protocol. Then there's dilution guide for high alert medication. Dilution guide for high alert medication is very important because those high alert medication usually without proper dilution will cause severe harm to the patients, even death. So there is this HOSHA's dilution protocol for drugs available in emergency department, and also for HTAA emergency department dilution protocol also. These are available online and can be referred. However, there are few precautions to be taken. Let's see what's the precaution to be taken. So I've already said that these are all just general reference. The information taken to be prepared for this guideline are the brand and injectable drug used on their own facility, and it's only valid at the time of publication. So the user for this guidelines are strongly advised to refer to the current product packaging that we are currently using. Sometimes brand might change, so the dilution might be different also. Let's see an example. So here we have cefepime. So on the left-hand side, you see that it's a guideline from JKNS, and the right-hand side is a guideline from KKM antimicrobial drug. So they are using different brand. For on the left-hand side, it's for PAR, and on the right-hand side is Cefmax. So what's the difference? For PAR, it comes with a provided solvent. For Cefmax, the user, which is usually staff nurse, have to dilute themselves using appropriate diluent, which is written here, water for injection, D5 or NS. As for the stability, also differ. For 4-par, as you can see, it's 24 hours under room temperatures, 1 week under fridge. However, for Max, it's all under fridge, can be stored stably for 2 days. So as you can see, it's very important to know what brand of the product are you currently using, because different brands have different stability and dilution protocols. Okay, so what should you know? This is the basic lah, aseptic technique while preparing the medication, glove and alcohol swab, etc. Okay, these are the don'ts. Do not use the product if you check for the physical appearance and there's any things, there is precipitation or change of color. So it's very important to check the physical before administering the drugs. Do not mix with other drugs. Always check for compatibility. So how to check for compatibility? There's actually a few guidelines. The most common guideline that we're using is this. So as you can see from the table, there's whether it's compatible or not recommended. However, if you're not sure, you're welcome to call up pharmacy to ask regarding the compatibility of different drugs. Any unused portion should be discarded after the recommended period. This I will discuss in details later. For multiple use vial, so you want to use, once the vial is open, is used for first time, it's always recommended to label with time and date, as we have to know there's a limited recommended period of use, right? So you have to calculate from that specific time and date for how long you can store the vial. The 6 is not quite common, but some of the medication does require you to flush IV line before. You should, depending on the compatibility, whether it's a normal line or D5. Back to basic hand hygiene, changing of glove between patient, and discard used device and needle and syringe into sharp bin. This is an example of sharp bin. Sharp bin have to be tamper-proof, have to have a tamper-proof lid, and immediate report if there's any needle prick injury. In SUSMED, we do have post-exposure prophylaxis regime available. Okay, so reconstitution and dilution, what's the difference? So reconstitution is when the product given is in powder form. So you have to add solvent in to make it a soluble form. Dilution is where you the soluble form of the drugs have to be further dilute into 1 pint or 100 ml of normal, suitable diluent before administering the drugs. So why does the medication sometimes come in the powder form? It's mainly due to the instability in liquid form for an extended duration. So let's see here the difference between reconstitution and dilution. Some drug may not need to be reconstituted, but need dilution. For example, clindamycin here. Second one, benzathine penicillin need to be reconstituted, but does not need to be further diluted. Next, there's azithromycin injection that require to be reconstituted and also further dilution. And lastly, the common use medication ampromycin injection, which does not need to be reconstituted and does not need further dilution also. So as you can see, it's very important to take note of each of the medication, as some need and some does not need to be further diluted and reconstituted. So there are ampoules and there are vials. So ampoules are for single use only. However, take note that the stability might be longer if it was further diluted, depending on the product. As for vial, it can be multiple use or single use. Again, I have to emphasize here, please refer to the product leaflet. Stability is different after reconstitution and after dilution. I may I'm going to show a few examples. So let's see here, dexamethasone. So after reconstitution, it has to be used immediately. Oh no, this is an MPU, so it does not need to be reconstituted. As MPU, as I said, if it's not further dilute, it has to be used immediately. However, after dilution, which is written here, dilute with 50 ml of normal saline or D5, it can last up to 24 hours. So diluent specific for each product should be used for reconstitution and dilution. Example, some of the product may come with their own diluent or solvent, such as are placed in this picture. So there's a powder bulk and there's a solvent bulk. So you have to mix it together instead of using our own normal saline or D5. Storage and stability. So the storage condition for materials should follow the required storage specification of materials or product. This can be referred to the product leaflet. So another point to be taken are temperature. So there are many criteria and many specific terms in the product leaflet that refer to the temperature. I would explain it here. So as you can see, what's the meaning of freeze, to keep in freezer in product leaflet or to keep in refrigerator. So as a general guide, freezer means -20 to -10. Refrigerator means 2 to 8 degrees Celsius. And the one I'm going to focus is on protect from light. So some of the medication have to be protected from light, which is a very important storage condition. Some of the product might lose its efficacy if it's exposed to light. Okay, so why is the storage condition and temperature important? Oh, and also diluent. Let's see an example, which is ceftriaxone. As you can see, different diluent might produce different stability. The concentration, how much you dilute it with the diluent, also will affect the stability. And lastly, the temperature. If it's kept under room temperature, it has different stability. If it's kept in the fridge, it has different stability. So these are all the main important points to be kept in mind while storing used medication for multiple use ampoules or vials. Okay, let's talk about some specific dilution that require calculation that are common in wards. First, there are inotropes, of course. So IVI of inotropes, mainly the common one are NORAX, dopamine, dobutamine, and adrenaline. So if the doctors order single strength, it's dilute 1 ampule in 50 ml of diluent. Double strength, it's 2 ampule in 50 ml of diluent, and so on and so on. However, for adrenaline, it's kind of different. A single strength means that you have to break 3 ampules in 50 ml of diluent. So double strength will be double of that, and so on and so on. Okay. So usually the inotropes will be prescribed in infusion rate. So we have to calculate the flow rate. So how do we calculate the flow rate? So we use the infusion rate as the prescriber has prescribed, then times 60 minutes and times weight, and you divide it by the strength of the dilution of the inotropes that you have diluted, depending on the strength, double strength or single strength. So that's an example here. IVI NORAD double strength run 0.2 mcg per kg per minute. The patient weight is 80 kg. So it's very easy. You just use 0.2 times 60 minutes times the patient's body weight. Then it's double strength stated here. So it's 8 mg in 50 ml. Then you'll get 6 ml per hour. Next, after inotropes, there's IVI insulin, of course. IVI insulin in what usually we have variable rate insulin infusion or fixed rate insulin infusion. However, the dilution is the same. 15 unit of atrapid, we are using atrapid. So 15 unit of atrapid in 49 ml of normal saline, then you'll get 50 ml of total solution, which is equivalent to 1 unit and of 1 ml. So according to the skills, each of the number represent ml, also represent unit, since that 1 unit is equal to 1 ml. Okay, for the last one, dilution for heparin. This is for heparin protocol. So for heparin, you can dilute 1 bar. You have to take note here, 1 bar of heparin of this is, we are using the strength of 5,000 per mil, not the 1,000 per mil heparin. So 5,000 per mil heparin have 5 mil in 1 vial. So 25,000 of unit can be diluted in 45 ml of normal saline, then you will get 500 unit per mil. Heparin infusion have to be infused via infusion pump. So as you can see from the left-hand side graphic, the rate changes according to the APTT value. That's +2, +3, +4, negative, -1, -2. So the number 1, 2, 3, 4 refers to the unit per kg per hour. As you can see from the graphic on the below. So you just refer to the 1, 2, 3, 4 on your left-hand side, then you can adjust how many mils per hour that you have to be adjusted. As you can see, the decimal point are the mils per hour. All right. So ensuring safer care for every patient, every time, everywhere is the vision established by WHO as the goals towards continuous improvement in patient safety and managing risk to prevent harm. As you can see, as I explained before, dilution, medication error happens in dilution are avoidable harm. So it is preventable. Hence, medication safety is everyone's responsibility so as to make the healthcare system safer. Thank you. That's all for my presentations. Any questions?
Thank you for our speaker today. Right now we are open to an open question from audience. While waiting for the questions, I received 2 questions from Sister Shahira Nazira. Okay, question number 1 on TPN. If not mixed yet, the TPN can be stored in room temperature. For how long you can keep in room temperature prior administration to the patient? And the question number 2 is, in administration of TPN, do we need to cover the tubing that goes to the patient?
Okay, thank you for the questions by Staff Nurse Nazira, isn't it? Okay, so for the first one, the expiry date for the bag that not being mixed yet, isn't it? So for the bag that is not being mixed yet, so we can follow the expiry date as stated on the bag itself. So usually it will so the expiry date is on the bag. So as we haven't mixed them yet, so so the expiry date just follow from the supplier, unless if it's already being mixed. So it will be for 6 days in the fridge, and then plus 1 day in the room temperature. Otherwise, just follow from the supplier expiry date. For the second question regarding the whether to cover the infusion drip or not, actually it's best if we can cover, or we can use, if we able to use the what we call it, light resistant tube, as light resistant tube, but I'm not sure if the nursing in the ward do have that or not. So as in pediatric, if I'm not mistaken, they're using a protecting syringe to infuse the lipid. But about the adult, I'm not sure, but best if we can use, but yeah.
We still open a question from the audience. Maybe we wait like 4 to 5 minutes. We're still waiting if the audience have any questions to our speaker for today. Okay, I got one question from Sister Shahira Nazira on dilution. What is the preferred diluent for medication which do not have diluent solution? For example, either normal saline or water for injection.
It mainly depends on different product have different preference. So it's advisable to refer to the product leaflet. If not, there's a guideline on isocyclate, the JKNS guideline, can refer that also. If the staff nurse is not confident, it's advisable to call up pharmacies, either on inpatient pharmacies or drug info center also, drug info DIS 2672 or 2591.
Okay, thank you. I think that's all the question we got from the audience today. Okay, again, thank you, Brother Chi, and thank you, Brother Shauki, for your talk for today. Okay, I would like to remind the participant to register attendance in iAttend for your CTD point and for medical practitioner to fill in the Google form through the link given. With that, we end our CME today with Tasbih Kafarah and Suratul Ams. Again, thank you everybody.
Thank you.